Hi, friends! Today we'll discuss a very common confusion in clinical practice. Rybelsus, Ozempic, and Wegovy, are they the same drug or different? The simple answer is that they contain the same molecule, semaglutide, but they are used differently. Let's start with Rybelsus. Rybelsus is oral semaglutide and is taken once daily for type 2 diabetes. It is started at 3 milligrams once daily for the first 30 days. Remember, this 3 milligram dose is only for tolerability and not meant for glycemic control. After 30 days, the dose is increased to 7 milligrams once daily, which is the first effective dose. If further control is needed, it can be increased to 14 milligrams once daily, which is the maximum dose. Rybelsus should always be taken on an empty stomach with plain water, at least 30 minutes before breakfast. Now coming to Ozempic. Ozempic is injectable semaglutide given once weekly for type 2 diabetes. It is started at 0.25 milligrams once weekly as a starter dose. This is then increased to 0.5 milligrams after 4 to 6 weeks. If required, it can be further increased to 1 milligram once weekly. Next is Wegovy. Wegovy is also injectable semaglutide given once weekly, but it is approved for obesity and weight management. It is started at 0.25 milligrams once weekly and gradually up-titrated every 4 to 6 weeks. The target and maximum dose of Wegovy is 2.4 milligrams once weekly. This weight loss data comes from the STEP program. In the STEP 1 trial, patients without diabetes lost around 15% of their body weight with Wegovy compared to placebo. More recently, the STEP Up trial investigated a higher dose of semaglutide, 7.2 milligrams, administered once weekly. In this trial, patients experienced an average weight loss of 21%, indicating that higher doses may lead to even more substantial weight reduction. However, this dose is not yet in routine clinical use. So remember this key point. Rybelsus, Ozempic, and Wegovy are not different drugs. They are the same molecule used in different doses and for different indications. They are not interchangeable. In real-life practice, remember one simple rule with the semaglutide. Start low and go slow. Start with the lowest dose. Allow sufficient time at each step to ensure gastrointestinal tolerance. Rushing dose escalation only increases nausea and vomiting and leads to poor adherence. If you found this helpful, don't forget to subscribe to Clinical Pearls for more practical tips that make everyday practice easier.